Over the last 24 hours, we have identified 875 new cases of COVID-19 in the province and completed almost 16,000 tests. That puts our current positivity rate at about 5.3%. Schools have resumed in-person classes. Right now, there are currently 4 schools on alert and 1 on outbreak. We have identified 6 cases in total. Our health system remains under significant strain. There are currently 820 people in hospital, including 137 who have been admitted to the ICU. Sadly, 23 new deaths were reported to Alberta Health in the past 24 hours. They ranged in age from 48 to 96, men and women whose passing leaves a hole in the lives of those who cared about them. I extend my sympathy to each person who is walking through grief right now, no matter the cause. As we hear every day about the impact of the pandemic, it is easy to start to tune things out. For example, for months now, I have been saying that we're all in this together, and I know that for many this phrase is wearing thin. For many people, this time we are in now is the most challenging moment in the pandemic so far. Few of us have ever lived through a time of adversity akin to what we are experiencing now, and hopefully we won't be tested like this again. But the phrase that I have often said is not a slogan. It is an irrefutable biological fact of COVID-19 that we cannot escape or choose to opt out of. COVID-19 shows us that a grocery store clerk is connected not only to the shopper, but also to the shopper's kids, their co-workers, and friends. It shines a light on the link between a long-term care resident and the worker who cares for them, as well as the worker's spouse, the co-workers of those spouses, and those co-workers' friends. COVID-19 doesn't care about anyone's race, religion, or political preferences. All that matters to it is whether an infectious person is close enough to another person for long enough to be able for the virus to spread. The information that our case investigators are currently collecting is on our new active cases. And so it's important to remember that because some of those locations like salons, barbershops, and in-person dining in restaurants have been closed for many weeks, we would not expect to see those in our current trends. It's important to remember again that the intent of the current restrictions is to reduce in-person contact as much as possible across the province. And we are thankfully seeing our numbers trending in a very positive way, and we'll be making decisions as we go forward based on those trends, and of course based on the information that we had from contact tracing earlier in the fall that helps us get a sense of the relative risks of exposure in those different settings. The message that I have communicated to Alberta Health Services is that residents in long-term care and designated supportive living facilities are a top priority, and that the rollout of vaccination to those individuals did need to be the #1 goal as they were looking at rolling vaccine out as quickly as possible. And I believe that's reflected in the fact that they have been able to hit the mark of making sure that they are giving that particular group of people access very quickly. With respect to the question on whether or not we expanded too quickly, it's always a balance, and one of the challenges if we have a smaller group of people who are eligible when we don't necessarily know how quickly they may be coming in to take up the vaccine, we wouldn't want to have appointments that could have been taken left empty because we don't have enough people coming in the door. We also, of course, want to avoid a situation where we have so many people eligible that they're needing to wait very long times to get their appointments. And we're trying to strike that balance where we have enough people eligible that we're able to always fill our available appointments. So there will always be a little bit of a need for people to wait and be patient. But of course, we always want to expand on that leading edge so that we're not leaving appointment space open and unfilled. My understanding of the impact that, again, the shipment, those 2 shipments that were expected this week, one I believe has arrived, the other one likely will arrive later this week. My understanding is that the impact of that has been in taking appointments that previously were open and available and closing them down. So I don't believe there's a large number of people who were scheduled to show up and that their appointment has been moved. I think the impact has mostly been in closing down possible appointments so people can't book into them. So it will have an impact. Any time that we have to move that around, of course, it can take longer for people who are currently eligible to receive a vaccine. It can take longer for them to get that appointment and to get those doses. But again, Alberta Health Services is doing a tremendous job at making sure that they're constantly monitoring their supply, their forecasting for appointments, and trying to reduce any inconvenience in people having to be rescheduled. So they're doing that again by closing off potential appointments in advance so that people aren't inconvenienced. With respect to the question about procuring vaccine outside of the federal government program, it is, of course, all of our goal to get as much vaccine as soon as possible to make sure that whatever vaccine is procured is coming through the importation process, which requires Health Canada approval from a safety and regulatory perspective. And then in terms of the purchasing, certainly if there is approved vaccine that is available for extra purchase, again, I think it's all of our goal to be able to offer vaccine to as many Albertans as soon as possible, if that's able to be done through the licensed and regulated products course of action.